Bismillahirrahmanirrahim. Assalamu alaikum. This is Tuba Khurshid from final year pharmacy. Today I will be giving presentation on Levonorgesterol. Levonorgesterol is emergency contraceptive pills. It is indicated in emergency contraception. It is available in capsules as well as in intrauterine system. In capsule, it is available in 26 mg of dose, while in intrauterine system, it is available in 52 mg. Drug interaction. Some drugs may cause emergency birth control to work less well by decreasing the amount of birth control hormones in your body. This effect can result in pregnancy. Examples include graciofulvin, rifampin, rifabutin, barbiturates, carbamazepine, felbamate, phenytoin, nalfenavir, and nevirapine. Mechanism of action. Levonorgesterol actually suppresses gonadotropin-releasing hormone in the hypothalamus. Hence, it results in the suppression of the luteinizing hormone, which is normal physiological hormone responsible for the ovulation. It inhibits the rupture of follicles and viable egg release from the ovaries. The intrauterine form of levonorgestrel likely prevent pregnancy by increasing the thickness of cervical mucus that will interfere with the movement of survival of sperm, and induce changes in the endometrium, where fertilized ovum is usually implanted. It alters the consistency of mucus in the cervix, which interferes with the sperm migration into the uterus for fertilization. Side effects include nausea and vomiting, abdominal pain, significant weight gain, which is on average 15 pounds, depression, ovarian cyst enlargement, gallbladder disease, high blood pressure, tiredness, dizziness, changes in vaginal bleeding, breast tenderness, diarrhea, or headache may occur. Drug toxicity include nausea and withdrawal bleeding. Brands available in Pakistan. Different brands are available. Intrauterine device is available with the name Mirena. It is very expensive with the price 8,381 and the dose is 52 mg. Other brands available with different doses with the cheaper prices than that of the intrauterine system. Alternative choices include gilipristol acetate, intrauterine device, and combined oral contraceptives. Why we have alternative choices? If woman has some hormonal problem, then gilipristol acetate is the best option because it is a non-hormonal pill. It blocks the key hormone necessary for contraception. And if woman is heavier than 165 pounds, then levonorgestrel is definitely not effective. For them, copper releasing intrauterine device seems to work better than pills. Irrational use. As we know that levonorgestrel is over-the-counter drug and it does not need any prescription, but if the woman is under the age of 17, then prescription will be required. It can be used as frequently as needed, but there are several side effects associated with it. But in some women, these serious adverse effects could lead to further health risks. These effects multiply with increased use. Now here is the case study. MM is a 24-year-old graduate student who presents the family clinic for the contraceptive counseling. She and her fiancé are planning to be married in approximately 3 months. MM states that she and her fiancé have been in a monogamous sexual relationship for the past 2 years and that their primary method of contraception has been via the inconsistent use of male condoms. She is here today to be evaluated for the use of hormonal contraceptives. MM states she began menses at age 14 with irregular cycle of 25-36 days in length. Her last menses was 2 weeks ago. The patient states she has heard about contraceptive options that keep you from having a period and she wants to know more about those options and if they would be okay for her to try. Here are the soap notes of my case study. Subjective. The only chief complaint is my fiancé and I are getting married soon and we are not ready for kids just yet. The objective, the blood pressure is normal, pulse rate is 66 is also normal, respiratory rate is normal, temperature 37 degrees Celsius, weight is 56 kg, height is 5 foot and 6 inches, which is normal, age is 24, skin mild facial acne, lung CTA no wheezing, breast equal size, non-tender, and genital and rectal examination shows normal, labs negative pap smear, and UPT assessment. Now, here's the assessment. She's young, she's healthy, she's a sexually active female, and she's requesting hormonal contraceptives for birth control. Now, here's the plan. Levonorgestrel is the best choice for emergency contraception. She will be counseled that she should take the levonorgestrel pill after, just after the sex, or she can take within 120 or 22 or 120 hours after unprotected and or under protected sex to help prevent pregnancy. If she's taking as a 2 tablet product, then take 1 tablet as soon as possible within 72 hours, and then second dose at 12 hours later. It works better if it is taken as soon as possible after unprotected sexual intercourse. Extra notes: emergency contraception is widely used to prevent unwanted pregnancy. Concerns about increased risk of ectopic pregnancy after emergency contraception use have proved unfounded, and possible teratogenic effect seems unlikely, so it is very safe to use. Emergency contraception consists of either 1.5 mg of levonorgestrel in 1 or 2 doses, or a combination of levonorgestrel with ethinyl estradiol administered for up to 5 days after unprotected intercourse. Clinical studies indicate that levonorgestrel alone is more effective and has less side effects. That is why alone levonorgestrel will be given to her or counsel her to take that. Although the true effectiveness of emergency contraception is impossible to estimate, recent research suggests that levonorgestrel in emergency contraceptive prevents around 50% of expected pregnancies in women using the method within 72 hours of intercourse. Here are the references from which I made my presentation. Thank you.